There's a message in our industry that gets promoted a lot, and I'm going to mention what that message is, also contrasted with some data that somewhat contradicts it. So, first, let me share a quick story with you about a bus stop. There was some research done at a bus stop where they had people that were part of this study go up to people and say, you know what, I'm a little bit short on change today. Is there any way that you could help me out with some bus fare? Now, how many people do you think actually helped them out? You probably think it was probably pretty low. You'd be right. It was about 10% of people were kind enough to help this person out. And the researchers were able to get this to 60%, to get 60% of the people that they asked to give this person money just based on one small change in the approach. The change was this: when they went up to somebody, they would say, I'm sorry, I'm a little short on change today. You're free to say no. But is there any way you could help me out with some money for the bus fare? What was the difference there? One small change is they gave the person permission to say no. So if we circle back to what I was referring to before with the message that we promote a lot in our industry, a lot of doctors will take a very in an effort to get patients to adhere better to their recommendations. They will take a very assertive approach with prescribing treatments. In some cases, a somewhat aggressive approach. I'm the doctor. I know what's best for the patient. I'm going to prescribe the solution. Do patients want some level of control in decisions that impact their health? Well, research shows a resounding yes. They absolutely do. Not only that, but over 50% of patients are dissatisfied with their level of decision making. So it's kind of a contradiction, right? In terms of the approach that we take sometimes and what patients want. And do we really want patients that are compliant but dissatisfied? Do we want them to go along with what we want them to do because we feel like we sort of force them to make that decision, but yet they leave the office dissatisfied? I think a much better approach in these situations, especially where we suspect that there's going to be some resistance or there is some resistance on behalf of the patient, is to do a better job making a convincing case for change, a convincing case to make a certain decision, to make the best option, and then letting the patient decide. Even if sometimes under the right circumstances, if that means telling the patient, you're free to say no.